Hi, my name is Milt Bedingfield. I'm a certified diabetes educator and exercise physiologist. I work in a major hospital, and I teach diabetes most every day of the week to patients that have diabetes. What I want to talk about now is a question that comes up quite frequently. Some of you may have had diabetes for 2 or 3 years, and they raise their hand in class and say, so what am I? Am I type 1 or type 2? I don't really know. If you're type 1, do you take insulin or what? Well, let me explain that to you. It's very simple. But I'm going to talk to you right now, in this brief period of time, the difference between type 1 and the difference between type 2. You've got to draw something first. Let's say this is your pancreas. It's not quite this big, and it looks a little bit different, but we'll go with this for now. These little circles are beta cells. Beta cells make insulin. And insulin is what's necessary to get sugar out of your blood and into your cells. Without insulin, there's no way that you're going to be able to get sugar out of your blood vessels and into your muscle cells, fat cells, or liver cells. Right now, we'll just put up 2 of these. Again, the only way to get sugar out of your blood and into your cells is if insulin picks up the sugar from your blood and takes it to your cells. There's no other way to get the sugar out of your blood. You may have heard that sugar gets burned up when you exercise. That's true. But that only happens once it's in the muscle cell. It doesn't get burned up while it's in the blood. It's got to get in the cell where it can be metabolized. So again, here's your pancreas, here's your beta cells, which make insulin. When sugar enters your blood from a recent meal, the beta cells will wake up and start making insulin. Once the insulin is made, the insulin is dumped in the blood, and once it's in the blood, it grabs a hold of the sugar and then takes the sugar out of the blood and over to a muscle cell, fat cell, or liver cell. Once the insulin takes the sugar to the cell, it actually opens the door and helps the sugar get inside. Without insulin, you can't get the sugar out of the blood and into the cell. And the sugar levels will accumulate and you'll get very sick. Now, let's say that last night, let's say we're talking about me. Let's say last night, while I was sleeping, my beta cells were killed. They were actually murdered. It's true, they were murdered. They didn't just die, they were murdered. What killed them? Let's pretend it's cold and flu season. And all of y'all in here are coughing and sneezing, and there are germs everywhere. And I inhale them, and I get some in my sinuses and some in my lungs. Once that happens, my immune system will be notified. There's germs up here and down here. My immune cells will travel to my lungs, kill the germs, hopefully travel to my sinuses and kill the germs. If all the germs are killed, I won't get sick. In the case of type 1 diabetes, let's put the beta cells back here. In the case of type 1, the immune system gets temporarily confused and mistakes beta cells for germs and actually kills them. One part of your body is actually destroying another part of your body. Doesn't happen very often, but when it does happen, you end up with type 1 diabetes. Type 1 diabetes is called an autoimmune disorder. Auto meaning your very own, immune meaning your immune system, where your immune system kills your beta cells. Now this happens over a very short period of time. Type 1 diabetes comes on quickly. One of the big symptoms of type 1 diabetes is a very rapid weight loss. You normally develop type 1 diabetes when you're a child or a young adult. You could develop type 1 as an older adult, but that would be rare. Normally you're a baby, child, young adult. They call it juvenile diabetes. So once these beta cells are killed, let's say you put sugar in your blood with your most recent meal, message comes over asking the beta cells to make insulin. There's no beta cells, so you can't make any insulin. The sugar has no way of getting out of the blood, and it stays trapped in the blood. The more food you eat, The higher blood sugar levels get, and you'll become very sick. You might have all your beta cells on January 5th. By January 10th, they're all gone. And you'll get sicker and sicker. Your weight will decrease. You'll lose more and more weight because without insulin, not only does the sugar stay trapped in your blood, but you cannot get protein out of your blood and into your cells either. And your cells will shrink, get smaller and smaller. You will lose weight. You'll have plenty of nutrients in your blood from the meals you're eating, but those nutrients will be filtered out of your blood by your kidneys. You'll get rid of them, and none of those nutrients can actually get in your cells. So your cells basically starve and you lose weight. You look like a mal-fed individual. So type 1 comes on quickly. It's characterized by a rapid weight loss. You normally develop it when you're a child or a young adult. Since you don't make any insulin, you have to inject insulin every day. And if you figure out how much sugar you're putting in your blood with every meal, and you take the right amount of insulin to get that sugar out of your blood and into your cells, your blood sugar levels are normal. One misconception is that type 1 is worse than type 2, because with type 1 you must take insulin. It doesn't necessarily mean type 1 is worse than type 2, it's just different than type 2. And again, at this point, there's no cure for it. In type 2 diabetes, it comes on much more slowly. It's estimated that type 2 diabetes takes approximately 10 to 12 years to develop. Again, type 1 comes on in about a week or so. Type 2 takes 10 to 12 years. In the case of type 2 diabetes, what happens is you start off with all of your beta cells, but over the course of about 10 to 12 years, the beta cells gradually die off. They die off because they're overworked. They get fatigued. So in type 1, the beta cells are killed by the immune system very quickly. Type 2, the beta cells die off slowly, and they die because of overuse or exhaustion. Once about 50% of the beta cells have died, there's no way the remaining beta cells can make enough insulin to get the sugar out of the blood and into the cells. So now you have an elevated blood sugar and you have type 2 diabetes. What causes these beta cells to die is overwork. Because what happens if the person is overweight, doesn't get much exercise, and eats a whole lot of carbohydrates or sugars, what happens is, particularly if the person's overweight and doesn't get exercise, what happens is it ends up taking a lot more insulin to get the sugar out of the blood and into the cell, which means the beta cells have to make a whole lot more insulin for a period of about 10 years, and so like anything else that's overused, it wears out. Usually the causes for type 2 are being overweight, particularly over fat, and not getting enough physical activity. Type 2 is considered a lifestyle illness that used to be called adult onset, but now it's just simply considered a lifestyle illness. We have far more type 2 diabetes than we've ever had in the past. About 24 million people have type 2 diabetes, and it's estimated that the number's just going to keep climbing. Type 2 diabetes is now called an epidemic. Type 2, again to review, type 2 comes on slowly over 10 to 12 years, and it has to do primarily with the way we lead our lives, not getting enough exercise and being overweight. Type 1 you have no control over. You get it regardless of how much exercise you're getting, regardless of how thin you are. You have no control over whether you get it or not, and it comes on quickly. It's characterized by weight loss. So I hope what I've explained here has made it more clear as to type 1 or type 2, the differences between type 1 and type 2.